What looks like a simple case of colic can actually become one of the deadliest emergencies in horses. A healthy horse is eating breakfast one moment and fighting for its life the next. And hidden deep inside the abdomen, there may be a silent killer wrapping itself around the intestines. It's called a strangulating lipoma. Today, we're going to explain exactly what a strangulating lipoma is in horses, why older horses are especially at risk, the warning signs every owner should know, and how fast veterinary treatment can mean the difference between life and death. Because when it comes to this condition, every minute matters. So what is a strangulating lipoma? A strangulating lipoma is a fatty tumor that develops inside a horse's abdomen. Now, before you hear the word tumor and panic, lipomas themselves are usually benign, meaning they are not cancerous. But the danger comes from where they form and what they do. These fatty masses often grow on a long stalk of tissue called a pedicle. Over time, that stalk can wrap around a section of the horse's small intestine like a rope. And once that happens, blood flow to the intestine becomes cut off. The intestine becomes trapped, strangulated, and begins to die. That is why this condition is called a strangulating lipoma. And unfortunately, it is one of the most severe forms of colic a horse can experience. Strangulating lipomas are most commonly seen in older horses. No one knows exactly why some horses develop these fatty tumors while others never do. But age is definitely a role. As horses get older, fat deposits inside the abdomen can slowly enlarge. Eventually, one of these fatty masses may develop a thin stalk. At first, there may be absolutely no signs. A horse can appear perfectly normal for months or even years. But if that stalk loops around the intestine, the situation can turn catastrophic very quickly. This is where things become extremely important for horse owners. The symptoms usually appear suddenly, and because the intestine is losing blood supply, the pain can become severe. Common signs include pawing, rolling, looking at the flank, sweating, elevated heart rate, refusing food, depression, repeatedly lying down and getting up, and basically severe colic symptoms that do not improve. Some horses may initially appear mildly uncomfortable, only to deteriorate rapidly. Others experience violent pain immediately. One of the biggest warning signs is colic that does not respond well to pain medication. If your veterinarian gives standard colic treatment and the horse remains painful, surgery may become urgently necessary. So why is this condition so dangerous? The intestine depends on constant blood flow to survive. When a strangulating lipoma cuts off circulation, the intestinal tissue begins dying. As that tissue dies, toxins leak into the abdomen and bloodstream. This can lead to shock, infection, and ultimately death. And sadly, the longer the intestine remains trapped, the worse the prognosis becomes. This is why veterinarians treat strangulating lipomas as true emergencies. Not tomorrow, not later tonight, immediately. One of the frustrating things about strangulating lipomas is that they can be difficult to diagnose without surgery. Veterinarians often begin with physical examination, heart rate assessment, rectal palpation, ultrasound, nasogastric tube evaluation, and blood work. But even with advanced diagnostics, the exact cause of the colic may remain unclear until the horse is taken to surgery. That's because the fatty tumor is hidden deep inside the abdomen. Many horses with strangulating lipomas are diagnosed only after exploratory surgery begins. Unfortunately, there is no medication that can fix a strangulating lipoma. Once the intestine is trapped, surgery is almost always required. During surgery, veterinarians enter the abdomen and locate the strangulated intestine. The lipoma and its stalk are carefully removed. Then the surgeon evaluates the intestine itself. If the tissue is still healthy, the horse may recover very well. But if part of the intestine has died, that damaged section must be removed. This procedure is called intestinal resection, and it significantly increases both the complexity and the cost of the surgery. So what's the reality? Colic surgery for strangulating lipomas can be extremely expensive. In many areas, treatment may cost anywhere from several $1,000s to well over $10,000, depending on complications. Hospitalization, anesthesia, medications, and intensive aftercare all add up quickly. This is one reason why horse owners are encouraged to discuss emergency plans with their veterinarians before a crisis happens. Because when a horse develops strangulating colic, decisions often need to be made fast. So can horses survive? The answer is yes. Many horses do survive strangulating lipoma surgery, especially if treatment happens early. In fact, advances in equine surgery and anesthesia have dramatically improved survival rates over the years. But timing matters enormously. The sooner surgery occurs, the greater the chance of saving healthy intestine. Some horses go on to return to riding, showing, and completely normal lives. Others are not as fortunate, and sadly, some horses are discovered too late. So why should you pay attention with older horses? If you own a senior horse, this condition is something worth understanding. This does not mean every older horse will develop a strangulating lipoma. Most never will. But knowing the signs of severe colic could one day save your horse's life. Many owners delay call the veterinarian because the horse seems a little uncomfortable. But strangulating lesions are not simple stomach aches. The clock is ticking from the very beginning. So are strangulating lipomas cancer? The answer is no. Lipomas are benign fatty tumors. The danger comes from the mechanical strangulation of the intestine, not cancer spread. And are older horses at risk? The answer is unfortunately yes. Senior horses, particularly older geldings, appear to have higher risk. And is surgery always necessary? In most cases, yes. A strangulating lipoma typically requires emergency abdominal surgery to save the horse. One of the hardest things about horses is how quickly everything can change. A normal morning can suddenly become a terrifying emergency. And conditions like strangulating lipomas remind us just how fragile the equine digestive system truly is. But they also remind us why education matters. Because recognizing the signs early, making the call quickly, and acting fast can save lives. So if you found this video helpful, consider sharing it with another horse owner. It could save their horse's life. And remember, I am not AI. If you listen closely, you can hear me breathe.